Hello everyone, this is a video on threadworms infection where I'll be talking about threadworms, signs and symptoms of the infection, the medicine for it, and how to manage this infection. First, I'll briefly explain about threadworms. Threadworm is a type of worm that can infect the large intestine of a person. Threadworm is also known as pinworms, and this infection is commonly found in children. Some parents might feel ashamed or embarrassed when they talk about this infection, but there's actually no need to feel embarrassed as this is a very common infection in children. The treatment or medicine can be bought easily from pharmacies or any shops that sells it, such as the supermarket. Now I will talk about the appearance of the threadworms. The threadworms can be seen in the feces or stools of the infected person. They appear as white or cream-colored thread-like objects. They are about 1 centimeter long and less than 0.5 millimeters in width. The worms can survive outside the body for a short amount of time, so you can see them moving around. So how do we know if someone is infected by threadworms? Normally, the first sign that you can notice is that the person is scratching his or her bottom. This is because itching around the perianal skin, which is the skin area around the anus, is the main symptom of this infection. Itching is usually worse at night, and this is because during nighttime, the female worms will come out of the anus to lay their eggs onto the surrounding skin. So why does the itching occur? The itching is actually caused by the allergic reaction to the substances of the worm's eggs, which are laid around the anus. The eggs are secreted together with a sticky irritant fluid onto the perianal skin. Some other symptoms include diarrhea, which can be seen in severe cases of infection, and itching around the vaginal area for girls. The treatment for this threadworm infection is albendazole or mebendazole, which usually comes in tablet and suspension form, which is the liquid form. Some examples of the medicines available in the stores are Zental, Noxworm, and Calpol brand. The active ingredient for Zental and Noxworm is albendazole, whereas for Calpol it is mebendazole. Albendazole and mebendazole work by preventing the worms from absorbing the sugars they need for survival. They kill the worms but not the eggs. Now I'll talk about how to take the Zental brand medicine. The medicines for this brand are available in tablets of 200 mg and 400 mg. And there's also suspension form, which is having a dose of 400 mg per 10 ml. So how do you take it? The recommended dose for children over 2 years old and adult is 400 mg as a single dose, meaning that you take one 400 mg tablet or two 200 mg tablets. Or if you're using the suspension form, you should take 10 ml, which is equivalent to 2 tablespoons. While for children of 1 to 2 years old, you should take 200 mg as a single dose. This is equivalent to one 200 mg tablet or 5 ml of suspension, which is equal to 1 tablespoon of the liquid. Note that for the suspension form, shake the bottle first before using. If there's difficulty in swallowing the tablet, you can chew the tablet with a little bit of water or crush the tablet, or just take suspension form of the medicine. Sometimes, reinfection may occur, meaning that the person who is already recovered from the threadworm infection, but then gets the infection again. So if reinfection occurs, the second dose can be taken again after 2 to 3 weeks from the first dose. Also note that this medicine should not be given to children under 1 year old and cannot be used by pregnant women or breastfeeding women. People who are living or sharing the same household as the infected person should also take 1 dose of the medicine. And anyone who have liver and/or kidney problems, please consult advice from the doctor before taking the medicine. The tablets should be stored under 30 degrees Celsius and store the suspension below 30 degrees Celsius and away from direct sunlight. Now for the management of the infection. As I've mentioned before, the medicine kills the threadworms but not the eggs. The eggs can live up to 2 weeks outside the body. Therefore, there is a possibility of getting reinfected again because the eggs can be stuck onto the fingers when the person scratches. Then it can be passed onto the things that they touch, for example, food and clothing. Then the eggs can be possibly passed to other people when they touch their mouth. Therefore, what you can do to minimize the possibility of getting reinfected again is to have good hygiene. Wash hands regularly and scrub the under of the fingernails clean. Keep your fingernails short and take a shower or bath every morning. Wash clothing, bed sheets, towels and toys and avoid sharing towels. And also clean the kitchen and bathroom surfaces. Now let's answer some pub quizzes. Number 1. Where does the threadworm infect? A. Lungs, B. Large intestine, or C. Liver? The answer is B. Large intestine. The threadworm infects the large intestine of the body. Number 2. The medicine works by killing the A. Worms, B. Eggs, or is it C. Worms and eggs? The answer is A. Worms. The medicine only kills the worms and not the eggs. Therefore, you will need to maintain good hygiene to prevent reinfection. Number 3. When should you take the medicine again if reinfection occurs? A. 1 day after the first dose, B. 3 days after the first dose, or is it C. 2 to 3 weeks after the first dose? The answer is C. 2 to 3 weeks after the first dose. If reinfection occurs, you can take the medicine again 2 to 3 weeks after the first dose. This is the end of the video. Thank you for watching.